Kia ora tātou. Thanks very much, Toa, for a lovely karakia and welcome. That's really nice. Thanks, Neil, online. And thank you, William, for the introductions in the background. Thank you all for showing up. It's really nice to give a lecture to what is family, friends, and really close colleagues who I've worked with for a long time. This is a really fun audience, so I'm really glad you're here. Thank you for coming. Yeah. Ko Canucanor te mana, ko Shannon te awa, ko Kerry nataiwi, ko Charlotte, Tig and Neve te whanau, ko Nevil takoingwa. I'm Nevil. I'm a statistician originally, as has been said a few times. About 17 years in now, I guess I'm a housing researcher as well. It's been quite a journey for me. So I grew up in the west coast of Ireland in a little village called Minagahan mostly, which is seen here with our local pier, and this is the entire community plus my kids, plus a few others. The village always had 42 in it when I was growing up, of which the entire left-hand side of the road was Pierce's. As I was growing up, I was always really good at maths, which is a good intro for a statistician, and really bad at languages. I found out as I was going along I was diagnosed with dyslexia, and I was quite dyslexic and really struggled to get words down on paper. Fortunately, Word has come along and helped me along the way. But other than that, I do recognise that my mum in particular, who had been a chemist and a teacher before me and had gone to university, really ensured that the expectations for me that I would always go to university. The other alternative was farming or fishing, and those were really hard work. Being a statistician always appealed to me, despite everybody suggesting that, hey, if you're good at numbers, accountancy's for you. I thought statisticians sounded much more exciting and that we'd be a really hip bunch. That's always been the case with the many I've worked with. So yes, in a bit of a detour at the end of my class, most people went off and became stockbrokers and worked for the merchant banking in England. I went off to work for a medical research council and the Health Effects Institute in Leicester. My project at that stage was looking at, we did a big survey which we put out on wheezing and coughing, and we built a model of air pollution, which was in retrospect pretty easy. There was one big huge road that went through the centre. If you were close to the road or on the eastern side, you got all the air pollution from the road, and there was 2 dairy boilers. So it was a pretty easy model to build, but hey, it was nice, made me feel good. We ticked off all the things we were meant to do in the grant. And wrote the paper, and that was all going very, very well. Then as a statistician, I was helpfully wandering around some PhD students who were struggling with, I met a PhD student who was struggling with stats, and her problem was trying to work out the black carbon in people's lungs. She was Nita Kulkarni, who I still admire to this day and keep. And she wanted me to count and help her count how much black carbon was in people's lungs, cells that they'd coughed up from the lungs. So we wrote a computer program to do that, and that was fine. But then we were like, why? So her theory was that, and she'd asked them about asthma symptoms, the black carbon in people's lungs would influence their asthma symptoms. And this sounded quite reasonable. So we did the statistical tests and that was fine. And then I said, oh, well, you have all these people's addresses. We'll just pop them into the model and see what the air pollution's like. No ethics or anything, but it seemed like a good idea at the time and was probably worth a look. So having done this and discovered that the air pollution at the child's address explained 70% of the carbons in their lungs, which explained 40% of the decline in lung function observed. We went to the professors who were very esteemed back in those days, and clearly they've dropped standards today. and said, hey, we found this out. Doesn't this look cool? Could we add this to the paper that we're pretending to write? And they went, whoa, stop, hang on, this is really cool, and you've done a few things slightly out of order here. So they started writing a research grant immediately, which as a research professor would, when an interesting idea is presented and complete, you go, oh, I need a grant to, to explain what I'm going to do. So yes, so we wrote up the grant, got that through and then got our data audited almost immediately. We were told, hey, we're going to audit the whole statistical process and the process from start to finish. The reason being, this was the first time anybody ever linked air pollution to biological measurements to actual symptoms. It's still my most highly cited paper in the New England Journal of Medicine. It really struck a few things home for me, getting my data audited and really simple models and being told, these are the best models by the epidemiologist who I still respect, who wrote up the Dotton Hill studies about smoking, said, keep your models simple always if you can. You're just trying to explain the obvious. Smoking is always, we knew for ages before we did the study that smoking was bad for your health. That air pollution is bad for your health is pretty obvious, but we do need to explain this and quantify this and put it up in nice, simple graphs that anybody can have a good look at the straight line and see what's causing the damage here. And I found that really inspiring, and I found that a really neat use of statistics to try explain these things. Then that institute closed down, and I went around the world with my dad on a really exciting trip. Found New Zealand, loved it, went back to Ireland, and then applied for a job with Philippa Howden-Chapman, who I hadn't recognized at the time, but read a few papers of in preparation for an interview, and said, wow, this looks really cool. Little did I know that it was not only Philippa, but a really great team. This is He Kayanga Oranga about a month before I joined it. I'll tell you, we all look exactly the same. I'd like to point out there's Helen, Philippa, Julian, and Rafe in this picture. You can spot them. But actually, Philippa has always mentored me and inspired me, and her work on the insulation paper forms part of this and forms the basis of that. I will point out to William that the insulation study and all that came after it was funded by a charitable grant first as a pilot project by Hutman, a charitable trust with non-overheads. Some people in the audience will get the reference. So we came in and I was managing the Housing, Heating and Health Study, a community-based intervention trial. So we randomly picked out, and I know this was done randomly because I did it. Of the 409, we measured everybody at baseline, and then we randomly gave 205 heaters because we were quite generous. And then we gave 204 heaters the next year. So we had a year's difference that was caused directly and only by the fact that I had randomly picked these people off a list. Here's the real banger of this thing. Putting in a heater increased the temperature in the home. Worked about the same as insulation. That also increased the temperature in the home. A more efficient heaters use less energy. That's what they say in the tin. That's what we proved. Doing this improved the child's health. It improved their wheezing. And when they were healthier, they had less days off school and they had less visits to the GP. And the adults in the house had less visits to the GP as well. Eye-opening and actually very informative. One of the things I went on to do my PhD on the heating study, and with Richard Arnold, Michael Keel and Philippa supervising me, it's really fun to do a PhD and to kind of delve way too deeply into something. So 1.3 million temperature observations later, we had having a look at the correlation between temperature and the children's lung function that they'd very helpfully recorded. It's the cold temperatures that cause the children's lung function to decline. The colder the temperature, the more the child's lung function declines. Temperatures less than 12 are particularly bad. Average temperature doesn't really help because going too high doesn't matter at all and doesn't save the situation. It's the cold that's the problem. really profound and deeply thought out Poisson models, and quite a lot of Bayesian statistics. I've really enjoyed my work with the Heikayang Oranga team. Actually, we're a really nice team, and we've done an awful lot. The insulation study has been absolutely pivotal, and is cited worldwide as the inspiration for policy. The heating study is the basis for adding heaters to much of the insulation. Michael Keel has done world-leading injury prevention, and I was really proud to be a part of those studies. And the key thing in injury prevention was to look at the whole house and everybody in the house, not just older people who are more at things. If you're doing a house intervention, you're intervening for everybody in the house, not just the one kid who had asthma, but it matters for everybody. Sleeping environments, and we've done a number of studies on that. Mold prevention, where I'd like to mention Caroline Haley in particular, who I had an office alongside for many, many years when we were over here. And has done a lot of work. Probiotics with Julian, energy payments led by Helen Viggers and Kim O'Sullivan, home repairs by many people, and much more. These are just a selection of the trials that we've done carefully with communities and with really awesome community partners, each and every one of them. Cokery being first and foremost amongst them, and Sustainability Trust here in Wellington. Most of these studies have shown positive, all of the studies have shown health effects. Some of the studies have shown significant health effects. Where there were failings, there were generally failings of power and statistical sample size and just getting it over the line. There is no doubt that the home environment is a great place to intervene. Doing it one thing at a time in a long list of things is a really inefficient way to go about doing a house. And it's a really inefficient way to go about changing people's lives. It's a really good scientific method, the randomized control trial. It's just not what the communities want us to do. And I've had many a learning from the community groups, and especially Cheryl, doing everything at once. Thank you, Richard, or you missed the part where you were an inspirational PhD supervisor. But very glad to have you here. So doing everything at once, doing one thing at once is really good scientifically and makes the statistics really easy. But it's not the most practical way of helping people out. For that work, we won the Prime Minister's Science Prize in 2014, and we are very proud of that. At that time, when we won the Prime Minister's Science Prize, 100,000 homes had been insulated, and 500,000 Kiwis were now living in warmer, drier, insulated homes because of that work. And it really does make a difference to do real high-quality evidence really, really well. I'd like to also acknowledge that a lot of the work and a lot of the hard work of the hard yards got done by students, and they're a great source of labour, inspiration, energy, and new ideas. And I have generally learned far more from my students than they have from me. Sarah Free, it's also interesting to see what they go on and do. Sarah Free is just stepped down from Deputy Mayor of Wellington, where she's been leading out the housing work. Jane Oliver is a very esteemed researcher doing great work in Melbourne University at the moment, looking at rheumatic fever in housing. Trian Kucha, who gave her apologies today, is working with the Health Protection Authority and doing really good work there. Tim Foster's has failed miserably and been a medical doctor. And I really liked he was the first person I ever set foot in the IDI lab with and tried to get it working. I really fancied we'd get it done in about 8 hours if we concentrated really well. After 8 hours, I had a headache and realized that I had meetings for the rest of the day, for the rest of tomorrow, that it was really going to take a lot of work. Lara Rangipitu, who looked at social housing and is now, he's both here and works at MHUD, and put a lot of drafting work into the homelessness action plan. And really that document reflects the good work that was done in Lara's PhD as well. And you can really see it when you read it, if you know it well. Kim Nathan, who worked on the adverse childhood events, but particularly moving house and the damage that rapid movement and the high mobility it did to people, did to children and the social functioning. Brodie Fraser, who I've learnt an awful lot about LGBTIQ and intersectionality, and has now helped me write my latest grant, and is really one of the best writers and one of the best people to research with. Kia ora, Brodie. I've really enjoyed working with you, as I have with Claire, and the implementation, which is a very important part of doing good research, is working out implementation. It's also really hard and tricky, and the research isn't there, but I'm really looking forward to Claire's PhD coming out and finishing that. Karen Henshaw, who's been with MSD and MHUD and really looked at the policy environment and getting all those people involved, getting a hold by. And my two newest PhD students, Ellie Johnson and Jiteng Chang, who we're only starting with, but we're really looking forward to the journey. Yeah, so having looked at everything individually with a huge team of really talented researchers and a really talented team of students, I'd like to talk a little bit about Well Homes, which is now led by Kokari Marai and Cheryl and Linda, Cheryl here. These are the real simple interventions you can put together. Beds and bedding, carpets, curtains, the heating, getting the heating and insulation from ICA, some minor repairs, some mold cleaning, bit of MSD, getting the benefit assistance right. The first time we had MSD do a trial on a work with the Healthy Homes Initiative, they did 200 people and they saw were they all getting their full and correct entitlement. 196 out of 200 weren't. So I asked MSD, did they think that was evidence of a systematic problem? And they said, no, I couldn't see it. I don't know. I guess you get it right 2% of the time. Social housing relocation, which is we still don't have enough homes in New Zealand, and we still have much of our homes need more than this. And more than the Healthy Homes Initiative. I'd really also like to thank Gayleen and Bronwyn here, because Well Homes is one Healthy Homes Initiative, and you've really helped with getting that to where it can be. But there are actually now 18 of them up and functioning around the country. Central leadership and the phrase building the plane while flying it has been very often used. One of the things that stands out, and one of the big changes from doing randomized controlled trials, is this whakawhanaunga taonga, the connections, the relationships. One of the things that is obvious, and even was in our earlier trials, was when you send an asthma nurse into a home, a child's asthma symptoms will improve whether they're in the intervention or the control group. Even if I tell them to do nothing else, they will do it anyway. So I was really glad to move to a more integrated data infrastructure, and that's using the entirety of the government data to look across things rather than doing one thing at a time. So then on the integrated data infrastructure, thanks Ellie for this slide. So we took those 18 HHIs and we asked them all to, while they were doing it, and we spoke to them early, while you're doing it, please record who you're doing it with, when you're doing it, and all these other 35 columns, are actually we started off with 35, wound up being about 70 columns in my Excel spreadsheet. Please fill it out for each and every single one of your 28,901 referrals, realizing it's rather a big ask. But actually they did it, and fair dues to them, 18 community groups up and down the country. We now have the largest data set of housing interventions in the world, as far as I know, and it's on the integrated data infrastructure. We looked at 14,800 households and 75,000 people. It's scale, it's statistics, it's how you make a difference. And then we looked at the really obvious, hey, 3 years before we fixed your house, what was your health and outcomes like? And then 3 years after we stopped fixing the house. Fixing the house and I say fixing the house, but it's that whakawhanaunga taonga. It starts off with the house, but it's a conversation with people. It's about what they need. I've heard Gayleen say very many times, it's not whether it's about a house or not, it's whether it's about it working for the children and the families or not. And that's what really matters. And that's what I get the pleasure of investigating as a statistician. It's a real honor to be trusted with this. And it's a real honor to report this as my kind of numbers. But the Healthy Homes Initiative prevented 9,444.58 hospitalizations. I'm the only person who says the 0.58. But that is a massive number of children who did not go to hospital. The 43,000 hospitalizations that still happen, and that we still that still happen in those whānaus, were shorter, on average, substantially shorter. The days that children weren't in hospital, they were in school. The days that the people didn't have sick and are in hospital, the adults didn't have sick and in hospital, they were able to go to work, so they had reduced benefit income. Overall, the Healthy Homes Initiative, over 3 years, have saved $200 million in government expenditure. It is a massive achievement, and it is a massive amount of work. Yeah. In 2019, the Healthy Homes Initiative, not me, were awarded the Prime Minister's Spirit of Service Award, both on the Best Outcomes category and the overall award. It was a real group effort, and I'm really proud to be part of that group. And I'm really proud of each and every one of the providers up and down the country. The trust that they've given to me, their taonga, their data, I've really been honoured by that, and I really enjoy working with them and experiencing the anarchy firsthand in Well Homes of how it can be to work in a community, and then trying to understand that and distill it into one slide about numbers and very few statistical models. So yeah, thank you very much to the Healthy Homes Initiative. The other thing that's being, the other group that I'd really like to thank, and Julie Nelson, Carl McMinn, and Kerry Hawkes in particular, but the People's Project in Hamilton. Not only does every child and every person in New Zealand deserve to live in a quality home, they deserve to live in a home. Homelessness is a failing. Homelessness is a failing of our entire system. The People's Project, who I had the pleasure of working with, have now housed over 2,000 people in Hamilton. They've taken a housing first approach. They've moved people straight from homelessness to permanent housing. There's no in-between steps, there's no emergency shelters, there's no transitional housing. Housing is a human right, and housing is permanent. Anything else is just shelter for a while, and it's temporary. The principles that underlie Housing First in this model is housing is a human right. It's an open-ended commitment to service and to helping the people meet their needs when they're in the house. It's very much a very similar connectedness as the Healthy Homes Initiative, that nothing is too hard. We're going to deal with the problems of the whānau and the people as we see them. I'd like to mention scattered site housing. That it is not the best idea to put lots of people with very high needs very close together. They deserve, in semi-special facilities or specially built things, it's really hard to get well anyway. And people suffering from homelessness or who have experienced homelessness, it is a real shock to your mental health. Your mental health was quite often not great beforehand. To have lots of people with mental health problems together, I get annoyed with my neighbours, and they're perfectly fine people most of the time, except at 5:30 in the morning when the motorbike starts. They're lovely, but actually it's having to deal with people who require a bit more consideration is tough for everybody. Having a lot of people in high density is really tough. Separation of housing from services. Nobody should lose their house because of a commitment from another service. If you're not attending your doctor, you don't lose your house. If you're not attending your drug and alcohol, you shouldn't lose your house. You still need to be housed. Self-determination allows allowing people to think about where they want to be housed, recovery orientation and harm reduction. There is nobody who homelessness is the right answer for. It is a human right, not an optional right. I'd really like to acknowledge the work of one of my colleagues here. I'd like to acknowledge the work of all my colleagues, but in particular Jenny Ombler, who helped take a shot with me, and we wrote, having talked with the People's Project for many, up and down, on another initially funded, non-overhead funded grant for the first time. We wrote a MBIE program grant together, and thank you, Jenny, for that. Looking at five key things, looking at the outcomes for the peoples housed on the IDI, with the very esteemed Polyata Toa, the risk factors and experiences of the people, which Carl McMinn from the People's Project took time to do a PhD with us for, and that was a real pleasure. With Brodie, who led out and solved the LGBTIQ homelessness. First person to ever delve into real research in this topic, and really admire it. The implementation of Housing First, because these programs are tricky to implement, and Housing First is not has all the bits everywhere in New Zealand to be the perfect program, but we need to get all the bits together, and acknowledging that we have the bits and having a look at where we can do better. And it's really good to study implementation and to try give people advice on how to do it, because it's not easy. And Treaty of Waitangi and Housing First, because Housing First is an international model, so we can't just pick up something that worked well in central New York and say that'll be fine in central Hamilton. They're actually different. Speaking of that, and in particular, I really enjoyed my work with Kerry, Lawson, Te Aho and Paikea, looking at those principles, those international principles I talked about earlier, and how they overlap with Maori principles. And actually, when it comes across, these are a lot of principles about the Housing First, are a lot of principles about self-empowerment, self-determination for the person. The Maori principles are about empowerment, rangatiratanga, connectedness for groups. They're very similar principles. It's just a different lens of looking at it, and a different importance of putting the connections between people. So when we're rolling things out, I think this is, when we're thinking about what we want to do, this whakawhanaungatanga, this connectedness between services and this connectedness of people and groups of people, we need to get this into our research, and we need to get it into much more. We need to, it's a real, New Zealand has three huge assets in my view. It has really good data on the integrated data infrastructure. It is really innovative, smart community groups who are out there, whether in Kokiri, whether in the HHI or the People's Project, in doing Housing First, who are passionate about what they're doing. And it has some really neat ideas from the Treaty of Waitangi on how to do connectedness. And now that we're getting this, bringing that knowledge in, really does help our research and make it more holistic. And it's not just Maori. When you're talking about identifying people and thinking about them as a group, you need to think about each individual as they are. And that includes LGBTIQ and other high needs groups and other excluded groups. We need to as services, approach people for who they are, who they identify as, and work with them as they are, and not just as a person we're going to put through on a treadmill. So the 390 people, the 390 people who the People's Project housed, they're pretty typical of the New Zealand homelessness population, as in over half are female. New Zealand stands out in the world for having achieved the equality of homelessness. And definitely a sign, in my humble opinion, that our solo parent benefit could use a rework and a rethink, as well as quite a few of our other benefits. Generally working aged, and as an epidemiologist and a statistician working in New Zealand, the overrepresentation of Maori is something I see again and again in all the data sets. And decolonization has done a lot of damage to Maori, and there are some wonderful ideas in there in the communities about how to reverse this and how to solve these inequalities. We do have to reach in and make sure it all happens. So the homeless are hard to reach, right? That's what everybody said. That's what the grant proposal the first time that we answered under was. So the people with drug and mental health addictions, criminal records, sleeping on the streets, they should be hard to reach for government services. Actually, when we looked at those 390 people, 200,000 interactions with government services were already known and noted on the IDI. That is not, before, at that point, they were homeless on the streets of Hamilton. This is not a group that was hard to reach. This is a group that had asked for help 200,000 times. This is an utter failure to reach. The homeless people on the streets of Hamilton were more identifiable on the health data set than a random sample of the population. They were vastly more identifiable in the justice data set, and they were more identifiable in the tax and social development data set. This is not people who were hidden from in any way. They had all asked for help for a long time beforehand. 15 years beforehand, on the main benefit assistance, the light grey is the housing first group, and the darker grey is the regular population. They're clearly identifiable as a group in trouble in high needs, 15 years before they wound up in the streets of Hamilton. Homelessness is not from people not asking for help. It doesn't come all of a sudden. It comes from cracks and system failures. It comes from people with, and I'm using definite air quotes here, troublesome identities. But actually, it's people we need to reach better. We need to address them with their identities. We need to make sure that there are not cracks for Maori, there are not cracks for LGBT, that we are not leaving obvious groups underrepresented and homeless. 5 years before the baseline, they were 10 times as likely to be in the hospital system. They were 30 times more likely to be in the mental health system. They were more likely to be in the they were 30 times more likely to be in the justice system. They were only slightly less likely to be on wages and salaries 5 years beforehand. Homeless people try work and do work, and given the opportunity will once their lives have settled down. They were more likely to be receiving MSD benefit, which is a real challenge sometimes. So that's 5 years beforehand. 5 years afterwards, and we're now 5 years afterwards, the rise in income from both, income has risen from both benefits and paid work. They're still low, but they're fair enough. There's been big drops in hospitalisation and injuries, big improvements in mental health. Drops in justice interactions and a small rise in victimizations. And I point out the small rise in reporting themselves to be victims of crime as that start of people rebuilding the trust. It's a really interesting thing that now people are more likely to go to the police and say, hey, this has happened to me. It's 5 years afterwards, they're slowly rebuilding their whakawhanaunga Otago with the state services. And that's really good. As a statistician, I can't resist but putting up the actual numbers, but I did want to give the highlight slide beforehand. 44% less hospitalizations. That is an amazing number. That is all-cause hospitalizations are 44% less in the 5 years after people were housed. Homelessness is not working for the system. The most common interaction of the medical system and a homeless person is antibiotics, which is fair enough, followed by antidepressants. Antidepressants are not the answer to the homelessness. And that's a bit facetious, but it is also the most common interaction at the moment. So we need to house. If the problem is housing, we need to address the housing. There's a 73% reduction over 5 years in the most severe mental health usage. That is the answer to mental health. That is a bigger answer than Suzanne Every-Palmer stood here and gave her IPL. And that is a bigger change than any of the interventions that were shown up for the mental health thing, for mental health. Housing people, homeless people need to be housed first, and then they can improve their mental health, rather than trying to treat it by any of the current or past mental health treatments we have available at the moment. Police offences were down 36%, criminal charges were down 43%, and I noticed that's with the victimizations are up, that's with more interaction with the police overall. Their incomes from received from wages and salaries is up 138%. There's a pay rise you want to give us, William. But that's what you can achieve, and that is the achievement of really a fundamental intervention. The income from benefits, while the income from wages and salaries has gone up 138%, their income from benefits is also up because they're getting the correct entitlements at 17%. That is still an overall income of just under $20,000. when housing people with really good support by the TPP model solves homelessness, it does not solve poverty. Poverty, we need a main benefit assistance. I'd really like to thank the people in the People's Project. I got to talk to quite a few of them at various stages, particularly it's a real learning to ask people for consent to put on the IDI. It was the first big project we asked for consent, and to talk to somebody and to say, hey, I want to look at all your data forever, and to have the response of, yes, that's a really great idea. I am totally sick of the whole of government asking me for my name, address, ethnicity every single time. They need to look at the whole thing ever. And it was a real clue that the 200,000 number, when I saw it, actually, that's right. They do spend our time filling out the forms, and we're not giving the data back. We're not assessing these things right. So all the other ones are prime ministers. This is me campaigning for more money for Housing First before an election. Anybody can be homeless. Look, we're approaching time, and I'm conscious of that, but I do want to bring out a few ideas. And really to stress the wonderful community intervention. Really high quality research takes a long team and takes a long time. People are still putting in insulation in various countries, and the WHO standards are still quoting the insulation study. 20 years we've seen massive, 20 years of high quality evidence. We've seen huge national impacts, but we've seen a real consciousness change. When I was the first 2 weeks, I was here, Philippa, who has carefully guided me throughout my career, guided me into the Ministry of Health, where we sat down and had a conversation about our theory about housing affecting health and how we were going to insulate homes and put heaters in them, and being told, nah, housing has nothing to do with health. And that was the official view. Now there's been a complete consciousness change, and I do remember sitting in the back of an Uber driver recently with Philippa, and the Uber driver telling us about how his housing was affecting his health and how they should get on and do something about it because we were going there. I'm really glad, and it's a real sign of change when that kind of things happens. There's been huge national impact here. The ECA scheme has now done 400,000 homes for about 4 billion in benefits. I'm hoping I got that number right. That's we've Arthur Grimes in the audience. There's been major international impacts. The decent home standards in the UK have quoted heavily on it. The Australians, there's several attempts in Australia to reproduce the insulation scheme. Yeah, and the evidence of insulation and heating has spread worldwide. The US and Canada, Spain and France have all taken the study up once. Have all taken the study. I remember talking to Edinburgh City Council and Portrua City Council back to back. Edinburgh City Council saying, this is wonderful evidence, this is spot on and really applicable to us, and talking to Portrua City Council and saying, hey, and I'm asking, can you break it up into Portrua East and West? They're like totally different. And you get caught up in local viewpoints, but actually internationally this has made a massive difference. There's been about 150 million or so, or 50 million at least, and there needs to be another 100 million in the Healthy Homes Initiative. And there's 200 million of benefits in that. There's been 200 million invested in Housing First. We now have a homelessness action plan where we didn't before. And a homelessness action plan that's actually well thought out, just needs to be very well implemented and resourced to be implemented. We have healthy home standards where we never did before. And I'd like to thank Lucy and Sarah Beer and many of the team who helped lead out and ensure that when there was a change of government and when the legislation was needed, that the ideas were there. Not all the ideas are taken up, and I still passionately believe that every child's bedroom should have a curtain in it, and maybe a window that's like totally closed as a start. Sarah Beer has worked on the Tenancy Tribunal, and there on the understanding of how the Tenancy Tribunal works. You can now, if you're a tenant and you go to the Tenancy Tribunal, request that the file be sealed. it generally will be. So it can't be used as a landlord's as a blacklist. Kayang Ora and MHUD are two entirely new entities with wonderful potential. Kayang Ora has a particularly good board member at the moment. And actually has more houses in the ground than they ever had before. And Philippa is desperately going around with shovels trying to make sure of more of them and more of them appropriately. But it is a real change in what something that was called, what was at one stage referred to as the referring to themselves as slum landlords, is now about building homes and communities. MHUD has now 5 ministers, which is both a recipe for anarchy and a recipe for change and change across things. And I really admire the efforts to structurally change the delivery of housing, because housing is a real, literally is where the door of the house is, and opening the door is going to start with housing. And opening the door to that connectedness is about making sure that everybody as well is housed in a dry, safe home. We desperately need to improve our building standards again, though. A new house built today to code in New Zealand would not pass the Irish building standards from when I was born. We need to move to a code that is 40 years behind the European standard and keep up being 40 years behind. I think that would be an ambitious start for our building standards, but we have to improve them. Lastly, and most importantly, I really want to thank, I have had the wonderful joy of working with a great team of colleagues. This is when we won the Rutherford Prize in the latest of a series of things, but so many people and a large group working together, the energy and leadership. I'm very proud to be the co-director with Philippa of such a nice group. Working with our housing group and our housing team and my colleagues in the Department of Public Health is an absolute pleasure, as is working with the community groups. It's a real honour and a pleasure to have an opportunity I never thought I would have as a dyslexic statistician looking for something to do, and coming over to New Zealand 17 years ago for, hey, this looks really interesting, let's give it a go for a little bit. It's been a wonderful journey, and it's been a really fun journey. Thank you all for listening.